I was addicted to drugs, heroin, crack, alcohol, benzodiazepines, pretty much anything at that time. I was homeless in Detroit, walking around the streets aimlessly, kind of on my last leg. The family had pretty much pushed me away, didn't want anything else to do with me.
My life was hell. You know, I wasn't able to stay clean. Homelessness, didn't have custody of my kids.
Things were very, very bad at the end. I weighed about 30 pounds less than what I weigh today. I was tired, miserable, sick and tired of being sick and tired.
I was trying to just really kill myself. I was so depressed, just so guilty, so shameful that I just wanted to die, and drugs were like my only way to escape that pain, but it's also the reason why I wanted to die too, so.
Well, Home and New Vision opened in 1996, and my father put down the first 3 months rent on the first house we had. And today we're at over a $2 million budget. We've grown, and we've grown, it's the bittersweet because the need is there. And we not only work in Washtenaw County, but we also have a facility in Jackson, Michigan. And we have become an agency that fights back. We fight stigma. So we're not just in Washtenaw County, we're all over the state.
Last year alone, we served just shy of 2,000 individuals in our various programs. We offer approximately 14 different programs, varying on need and level of care desired. We keep demographic stats on everybody that we serve. The challenge is there is no one demographic that defines the population, and so we try to avoid that. For us, the biggest demographic is what is the primary drug of choice, as well as what other types of specialty services are needed. Within the last year, heroin has surpassed alcohol as the primary drug of choice. That had never been the case in the years prior. Alcohol comes in second, with other opiates, Vicodin, what have you, in third.
So Home and New Vision started off providing services for women with one recovery home. And it was years later when a local provider closed their doors, and we were asked by some county officials who provided funding for substance use disorder to take on that program. So that is when we started taking men.
This was my 6th or 7th treatment facility that I went to. I pretty much lost all hope. Home and New Vision gave me a shot, and I came in and have been clean since. Home and New Vision in the beginning, offered me the security and the safety that I needed in those first couple of weeks to get through detox and then get reacquainted with the recovering community. And then at transitional housing, I met some other guys in early recovery who were able to kind of lead me in the right direction. It gave me enough structure and accountability to where I feel like I was able to successfully manage to stay clean.
It's been very important, like the accountability they set in place here. And, it's also helped me to become responsible in paying rent, doing chores, just like, the things that normal human beings are supposed to be doing.
I really had to start from square one, how to be an adult, how to take care of myself, how to and this is my first time in recovery, so I didn't know anything about any of the pathways to recovery, much less the one that works for me. So I had to learn all of that, the whole recovery culture, everything, and to be able to do that in a safe place with supportive women around was incomparable. I mean, it was absolutely what I needed at the time.
Perception becomes reality, and we have to change the perception. And I would like people to understand that substance use disorder is a disorder. It is a chronic health issue. And that is the best kept secret for some reason. And I really feel like if we don't educate people on what this substance use disorder is, what addiction really is, and if we don't promote recovery, you have to promote recovery so that people understand that there is more to us than just our illness. And if we don't define ourselves, others are going to define us. And that is not for them to do, that's for us to do.
When I came to Home and New Vision, I had no idea what recovery was about. And since I moved to Ann Arbor, like, I really found a fellowship and like a new family. Yeah. It's amazing. Yeah.
How long have you been here?
In transitional housing, it's been about 11 months, and I have 13 and a half months clean and sober. Yeah, and I couldn't do it without this, without doing this, without the accountability, without my new friends, without going to meetings. And my house manager is an amazing person, and she pushes me to be the best me I can be.
Home and New Vision is an incredible program. They have great continuity of care from day one all the way through transitional housing to continuing therapy and whatever services I can think of that somebody might need, they have access to through Home and New Vision.
We have residential treatment, outpatient treatment, an engagement center for those who are frequent users of the emergency rooms, where they can come and we can support them. We can get them the help that they need. They can get them peers, case managers, and get them on the road to recovery. We have community case management, peer support, peer recovery coaching for people who are wanting to enter into the recovery world but frightened to do so, so they're supported through that process. We have clinicians that do clinical groups, individuals, and a lot of prevention programs for youth. My vision for public policy, it starts with reducing stigma and educating the community, the leaders, administration, and then we can change public policy. There's a movement out there to change policy. Unfortunately, it took the heroin epidemic to do that, but that's got enough recognition now that there has been some significant action taken place. My vision for Home and New Vision is to expand the services. We cannot expect to put people into treatment for 28 days and send them home and expect that they're going to be okay. There has to be recovery housing for those people so that they can learn to live life on their own, and they can experience, they can mimic living that life in recovery housing. I think that we need, and that can be long-term recovery housing, I think is important. Long-term treatment is important. We need to have programs that for looking at the readiness for change, so that those people who are not quite ready because they don't have the things that they need to even begin their life in recovery, we need to have facilities for that. I think there needs to be more engagement centers which treat people who are chronic users of the emergency rooms, the jails, and start getting them the treatment that they need.
It's beautiful. I presently now work for the Home and New Vision. I have a relationship with my family. I'm a responsible parent, a grandmother, a friend, a sponsor, a sponsee. And like I said, I've been clean down for 10 years.
Today I'm a 4.0 social work student. I'm an outreach worker with the Sheriff's Office. I used to run from the police, now I work with them, and I am also grateful to say that I work for Home and New Vision as well and help out with the Washtenaw Recovery Advocacy Project.
We're on the brink of changing the face of addiction and really celebrating recovery. My vision is that we be really good at what we do. And if others consider that a model, that's great. And our culture inside our program, the people that work with us, the people that work for us, the people who come through our program, we're all one. And we have mostly the same vision and the same goals, and that's to be the best that we can be so that our clients can have the best there is to offer.